So in our 16 hospitals, we currently have 553 COVID positive patients admitted to our hospitals.
At this point in time, our hospitals around the state have more patients than they have beds. Patients are waiting in our emergency departments for beds to become available. They're waiting in other hospitals to be able to come to hospitals with a higher level of care because of the number of patients there. And that affects all of us.
IU Health, Methodist, and University together have the largest ICU in the state of Indiana. And we recently had to add 35 new ICU level beds or intensive care level beds, as well as convert other progressive care beds into a space that can provide ICU level care.
The workforce challenges are real. We're seeing more and more individuals affected by the spread of this disease, and either being out ill or because of exposure. So we're having a lot of staffing challenges. We've been lucky enough to get the great partnership and great help from the Indiana National Guard and the Department of Health. We have the National Guard deployed across 13 of our hospitals. And then, as most of you know, just around Christmas, FEMA deployed, and we have our great partners here that are joining us on this call, clinical experts from the Navy that are helping us provide great care at the Adult Academic Health Center downtown at Methodist Hospital.
I actually just came off of a stint working in one of the surge ICUs, and we actually, the week prior, it was the process of converting from a progressive care unit into a full ICU level of care. And so as soon as we opened up the beds, there were patients waiting to take those beds, and we got up to capacity very quickly. And everyone has just been, everyone for, at this point, as far back as we can remember, everyone's been working so hard and working as hard as they can to take care of these patients.
Our team has been trying to be very flexible about their skill sets and where the hospital needs them to integrate into different nursing units, and the physicians going to where they're needed as far as staffing. And the hospital's been great about putting us where not only is our team comfortable, but where they're needed.
We are here to take care of you. We serve our community, and all of our hospitals across the state serve our communities in the best way that we can. The one ask that we have, and the one thing that we know to be totally true about COVID, is that it's a virus that's impacted all permeations of our life, all levels of our life. But what I can say is what we know is when you're vaccinated and you have the booster, it reduces your risk of having to be hospitalized or even death. That, I would probably say, is the biggest ask of your healthcare workers, is to take care of yourselves and protect yourselves and others from getting so ill that you require that hospitalization or that could cause an unnecessary death.